My name's Gwen. I formally wanted to welcome you guys all to Limitless. Those who have been here before kind of know who we are a little bit, but I've seen a ton of new faces and stuff here as well, which is so exciting. It really gets me fired up. Before we kind of get into everything today, I really want to introduce you guys to everyone we have working here today. You're going to see a ton of faces along the way. So like I said, my name's Gwen. I'm an orthopedic and balanced vestibular physical therapist here, as well as we got our whole team kind of in the back here. We'll start with Dr. Byron right there. If you can just turn our heads so you can see him. We'll go down the line.
Hi, my name is Byron. I am our outpatient orthopedic PT here. I used to work at our Brighton location when I first started with Limitless back in June of last year, correction, 2 years ago. And then I transitioned over to Greece about a year ago. So it's been really awesome to be here with our team and looking forward to giving you guys some good information today.
Hi everyone, I'm Kristen. I am recently just moved from Buffalo about a month and a half ago, so I'm so excited to be in the Rochester area. I am one of the orthopedic and pelvic therapists at Greece, so very excited to meet you guys.
I'm Bailey. I'm Byron's student. I go to Nazareth in their PT program. I'm finishing up my last year now, so that's super exciting. But I'm super happy to be part of something like this with you guys.
Hi everyone, I'm Priya. I'm one of the pelvic health PTs here. I moved right across the lake from Toronto a little over 2 years ago, and I've been in this office for about a year and a half now, and just so excited to chat with all of you guys today.
So bringing us all back together and stuff again, I want to speak a little bit about just who we are as Limitless. Obviously you guys are all here in Greece, but we actually have 2 other locations in the Rochester area. One over in Brighton, right on Lactaville Boulevard. As well as one down in Victor, kind of right off 96 on Main Street, coming down there as well. And we also have a location out in Cortland. So if you have Central New York friends, family out there, we have a whole troop out there who are awesome. As we kind of said, we're a small, family-owned, private outpatient orthopedic physical therapist outset here, but we also have some orthopedic conditions, pelvic floor, physical therapy, as well as balanced vestibular concussion, kind of the whole gamut, just so we can serve our community as best as we can. And those are offered in all of our locations as well. What we're here for today is learning about osteoporosis. So if you are here and you didn't think you were going to learn about osteoporosis, welcome, you now have to stay. So first and foremost, who here has heard of osteoporosis, is impacted by osteoporosis currently, or has someone they know who has been impacted by osteoporosis, osteopenia at some point in their life? Nice. Cool. Welcome in. So excited to learn with you guys today. Before we get going, I want to give a rundown of, hey, how is today going to work? So what we're going to end up doing here is there's going to be 3 different stations per se. Station 1 is going to be right here with me. We're going to learn about just, hey, kind of a little bit more about what is osteoporosis, osteopenia, kind of how is that broken down, what all does that essentially mean and how that can work, especially in the PT realm. Station 2 is going to be right down this hallway. There's signs along the way too, and we'll direct you. But that's going to be with Byron and Bailey. They're going to talk to and run you guys through some different exercises that can really help just manage osteoporosis and really lean into the realm of, hey, how can PT really impact osteoporosis and actually reverse some of the effects of osteoporosis. And then in our back room, there'll be signs and stuff along the way. Kind of our whole circle here is going to be with Priya and Kristen. They're going to talk to really the nutrition, fueling, kind of recovery realm of everything else that can go in and manage osteoporosis. Things with like diet and sleep can really impact and help support management of osteoporosis as well.
Our nutrition station, like Gwen said, I'm Dr. Kristen. This is Priya. We are your pelvic health therapist and orthopedic physical therapists at Limitless in the Greece location. So, what do we think we need for good bone health? I need 3 things that we're thinking food-wise that we may have heard. Yes, sir. That's 1.
Coaching.
Yes, that's 2. There's 3. Boom. So, biggest things we'll talk about first is vitamin D and calcium. So we can't have one without the other. We can't just say, hi, I'm gonna drink a gallon of milk every single day. Bones are gonna be super, super strong. Vitamin D allows our bones to unlock the mechanism in order for our bones to take up that calcium. So you do need both. So, number-wise, what we need for vitamin D is anywhere from 800 to 1,000 international units of vitamin D. So if we think we go into Walgreens, CVS, we have those vitamin D3 bottles. Usually they'll say 800, 1,000. we do need 1 tablet a day.
How much did you say that we needed to take?
800 to 1,000
Oh, okay.
international units, and that'll say on the bottle as well.
Okay.
Moving into calcium, we do need anywhere from 1,000 to 1,500 milligrams of calcium per day. So how the heck do we get all of those grams in there? Vitamin D, if we're like, hey, actually, yeah, my pill bottle's pretty full. I don't really think I want to put more pills in my pill box. Other ways that we can get vitamin D include the sun, which unfortunately for us, we live in a lovely area that doesn't get sunlight a ton of time, right? So in the summer, in the fall, really trying to get those outdoor walks in. That'll help us out. But hey, it gets winter. We don't get a ton of sunlight. So thinking salmon, egg yolks, fortified foods and cereals, yogurt. Those are our big vitamin D producers. Moving into calcium. Everyone always is like, yes, those dairy cows out in all the farms out there. Hey, gives a lot of calcium. But if you're like me and say, hey, ooh, actually, lactose, not my thing, not about it. My stomach's not handling it. How the heck am I going to get calcium? So tablets, those supplements that we've talked about. In addition to, you have your fortified cereals, your dark leafy greens. All of those are big sources of calcium as well. So you'll also hear from Dr. Byron, Dr. Gwen about the benefits of movement, but hey, we need to definitely keep our muscles nice and strong. How in the heck do we do that? Lots of protein, right? So as we start to get older, how much protein do we think we need a day?
25 grams?
Yes.
Okay.
So about 0.8 grams of protein per kilogram of body weight. So if we think of a 160-pound person, you're looking anywhere of 90 grams of protein. And if you're like, whoa, how the heck am I getting 90 grams of protein in my diet? We have a lovely day of protein that we can kind of go through real quickly. So breakfast, if I had 2 eggs and a Greek yogurt, yolk included, we do love those egg yolks. We're looking at 12 grams and 20 grams respectively. Moving into lunch, if we have a delicious chicken salad sandwich, depending on what type of bread you use, you can have a 30-gram protein sandwich. Moving into dinner, if you have a nice healthy piece of salmon, 25 grams there, some brown rice, about 5 grams, some steamed veggies, another 5 grams of protein for a whopping 97 grams of protein. So what you put in your body allows your body to use that to keep everything nice and strong. As we get older, we all hear the words, for as women, menopause, big things start to lose estrogen. Men, you're not immune to this, you start to lose testosterone as we get older as well. Both of those hormones are needed to keep that bone healthy and to slow the rate of reabsorption. As we get older, it's a natural part of aging that we lose those hormones. So fueling appropriately allows us to say, hey, bones, nope, we are not losing what we need to lose.
So we know that fuel and having the right kind of nutrition is important for our recovery, but equally as important is our sleep. So I want to talk to you guys a little bit about why sleep is so important for bone health, what is sleep hygiene, and what are all the steps that you can take to really improve your recovery and help make your bones really nice and strong. The first thing that I want to go over is, why is sleep so important? Why does it even matter, right? And we know that resistance exercise, as you're going to learn about today, is really important for building bone density. But sleep is when our muscles recover, when our bones recover, right? So we're working really hard all day, we're exercising, we're moving, but sleep is that time for our body to flush out inflammation, allow for our muscles and our bone to regenerate. So really important that we are paying attention to our sleep and just the amount of sleep that we're getting. I would say that sometimes if you're kind of struggling to see an improvement in your strength and we're not getting adequate sleep, then sometimes that can lead to frequent injuries, chronic pain, things like that. So just another reason why that's important. When we think about the benefits of sleep on our brain and our cognitive health, we know that overnight is when we're flushing out all of the waste products that our brain produces as well. So when we get enough sleep, then we can just have better kind of mental performance, better memory, better executive function. So all really good things that we all want to experience the benefit of. Sleep can also help improve our longevity, which we all want. And lastly, we all just feel better when we get a good night's sleep. Don't we all just feel happier, like we're in a better mood? So all really important reasons for why sleep matters. Now, when we think about how much sleep we should be getting, this number can vary anywhere from 8 to 10 hours per night. Every individual is different. Somebody needs closer to 8, some people need closer to 10 hours of sleep. A lot of people struggle with getting enough sleep in terms of the quantity. So for some people, their body just wakes them up. Even if you try to sleep, it's so hard to stay asleep. And I would say equally as important is the quality of sleep. So if you're struggling with getting enough sleep, at least we're gonna try and think about how we can improve the quality of sleep. So if you guys take a look at the handouts that I provided to you, on one of the sides it says quality sleep. These are all really excellent sleep hygiene tips that we're going to go over today. These are all kind of steps that you can take to improve quality and quantity of your sleep. So the first thing is consistency. Don't worry about the amount of sleep that you get, but go to bed and get up at the same time every day. This really helps our brain to understand that, hey, we need this routine in place, right? This is what the circadian rhythm essentially is. Next, we have cold temperature. So dial your thermostat between 65 to 75 degrees Fahrenheit. The colder the room, the deeper the sleep. So really important for our nervous system and a great way to signal to the brain that we need to get ready for sleep. Light is really important. Our eyes are like sensors sending signals up to the brain, reminding the brain what time of day it is, and really preparing our body for rest. So at night, we want to tell our brain that, hey, we need to get ready for sleep. So blackout curtains, avoiding screens, avoiding essentially any kind of blue light at least 2 hours before bed is important. And then in the morning, the opposite. Right now, this is the time for us to expose ourselves to sunlight. So getting outside or even kind of looking outside your window can be really beneficial. A great way to signal to the brain that now we want to wake up and we're ready to go. Avoiding exercise at night. Exercise can stimulate, kind of get your heart rate up, breathing up. And at night, we want to kind of wind down the nervous system, so trying to avoid exercise at night. Avoiding napping as well, because that can disrupt our sleep cycle. Avoiding caffeine afternoon, because we know the half-life of caffeine is 7 hours. Avoiding alcohol and spicy foods, that can sometimes disrupt our digestive system. And then reserving your bedroom for sleep and sex. So avoiding any other activities that can be stimulating, sometimes like even reading a book or watching the news or working in your bedroom can almost wake up your brain, and we want our brain to associate our bedroom with sleep. So this seems like a lot of different tips, and we've talked about a lot of different strategies for you. One thing that I would like for you guys to do is take a minute to think about what is one action item that you can work on. Out of all the things that we mentioned, what's one thing that you feel is important for you to do?
Okay. Again, my name is Byron. I am our orthopedic PT here in Greece, and we're going to kind of talk about how PT specifically with regards to like strengthening and resistance training, how this can help to kind of like offset osteoporosis and make your bones just more resilient. Okay. We're going to kind of talk about those movements specifically in terms of just like what's kind of happening with the movements that you guys just did and what it does to our bones to make them stronger. Okay. In terms of how this kind of works, right? When we do something where we put a stress to our bones, right? Our body has to react to that stress. We say, hey, for whatever reason, our body's very, very weak right now, or our bones rather are pretty weak, and we can't tolerate the stress. But what your body is going to do is it's going to send a signal to your bones and say, hey, we need to get very, very strong to be able to withstand this kind of activity or this kind of force. So when you do it again, you're going to feel more confident, and your bones are going to actually be able to handle the stress that you enact upon it. So if you're doing a squat and you feel kind of shaky with it, the more and more you do it, your bones are going to respond in a positive way to where your bones are going to be able to withstand a squat, or it's going to be able to do a burpee, or it's going to be able to withstand the marching exercise that you guys kind of did. This is going to outline in general in terms of just like different kinds of forces that you do on a day-to-day basis. If you're walking, if you're going up and down stairs, if you are a freaking exerciser and you're doing some sort of like jumping activities, it's all going to dictate how much stress actually goes to our bones, right? So if I'm walking, it's a little bit different than what my body has to do when I go up and down stairs at a faster rate, or if I'm jumping up and down at a fast pace, right? It's all going to be a little bit different in terms of like how my body has to respond to that kind of force. Going back to Bailey's movements, okay? So she had you guys do a squat first, or sit and stand, right? This is what we deem a progressive like resistance training method, okay? When I'm doing a squat, I'm putting a lot of stress to my hips, to my knees, to my ankles as I'm kind of going in and out of the motion itself. So that's just one way in which I can make my bones stronger to withstand that kind of that activity or that specific exercise. Okay. If we think about the burpee that she has you guys do, okay, you guys are moving at a slightly faster pace. Okay. So it's another way in which I can give my bones a different kind of like stimulus or a different kind of input. Say, hey, my body can't withstand, doing this movement at a very, very fast pace. But the more and more I practice it and the more I become efficient in that movement, my body's going to be able to move at a faster rate. I'm not going to feel, not confident with the movement or feel weak with it. Okay, so my bones are going to respond in a very, very positive way if I continue to do that specific movement or exercise. Okay, marching in place, right? Anytime you do this, I'm putting impact from my foot all the way up to my knee, all the way up to my hip. It's a different kind of stress that you guys are doing on a day-to-day basis. So when you go to step up on your stairs or curve, you're putting impact through those joints that we kind of talked about, to where our bones need to be very, very strong and resilient to be able to withstand that specific kind of force. So the movements that Bailey had you guys do, they're all different ways in which we can make our bones stronger. To go along with that, right, when we're exercising, specifically for individuals who don't have a lot of exercise experience and they're just kind of getting into just movement and exercise, or conversely, someone who has a fairly good knowledge and a foundation of exercise because they do it on a relatively consistent basis, okay? We can use a scale to kind of gauge like what our response to that specific exercise is, and it also gives me a good gauge on if I push it too much or if I can actually push it a little bit more. What we use is called the RPE scale, which means rating of perceived exertion. I can use this scale, and this is just going to outline what the scale itself is from 1 all the way up to 10. If I'm working at a level 10, that's telling me, or my system rather, my bones, we're working at a pretty good intensity level right now, okay? Conversely, if I drop all the way down to level 1, your bones are probably not having to withstand a lot of stress because you're not working at a very, very high intensity. So when you're doing squats, or you're doing lunges, or you're just exercising in general, I can use this scale to dictate how much I can kind of push myself, okay? It's very, very helpful for me as a PT and for my patients to use this scale because it gives me a good idea on like how much I can kind of push them, because I want to stay within a specific number or zone where I know I'm stressing their bones just enough, but I'm not doing too much that may, possibly cause an injury of some kind or just something that they can't tolerate just yet. So we typically like to use that scale to dictate like how much can I push, how much can I stretch your bones. In terms of just like overall the effects of resistance training, specifically on our bones, but not just our bones, right? When I induce a stress to my body, so if I'm doing a squat here, right, I'm gonna be able to build up a lot of joint protection and all of the different aspects of my ankle, my knee, my hip. I'm going to be able to build up a lot of protection in my bones because I'm doing something where I'm putting weight through it, okay? This list here is not, it's a condensed list. There are many, many different benefits of strengthening and resistance training on osteoporosis itself, aside from joint protection and aside from building bone health, right? It's going to also help to decrease your risk of falls. It's going to help a ton with just like your balance, more so functional balance and things that you encounter on a day-to-day basis. So this is just a very, very modified list of that. But in terms of just like what we know, what research shows about resistance training on osteoporosis and on heart health and on our muscles and our tendons and our bones, there are many, many benefits of resistance training on everything that we kind of talked about today.
What we're going to be talking about here is some falls and just what it really is osteoporosis, what can we do about it, knowing you just learned that kind of along the way, but we'll wrap up our realm here. Specifically related to this concept of fall risk. Again, big population across the world with your specific age range and this specific test. I will say in preface, there's a bunch of different tests that really determine, am I at risk of falling or not? This is just one of them. But this helps us look at to say, okay, where am I at number-wise of how many repetitions I got through in 30 seconds? If you're above the average, great. You're in a pretty good spot, as well as, average, you're average, great, congratulations. If you're below average, that just tells us, again, this is one test, but tells us really, there might be some opportunity there to help work on building some strength, some balance to say, ooh, do I need to work on some stuff because I'm maybe at a little bit of a bigger risk of falling. So looking at this as well of, falling and osteoporosis, why are they really connected and why are so many people talking about it? A, falls are bad, kind of regardless. Okay, I would say falls when you get injured are really bad. Okay, I just fell the other day because I tripped over my dog, and I was able to get back up and be okay. If we have osteoporosis or osteopenia, but there's potentially more of a risk of, hey, if we fall and we already have some level of osteoporosis, osteopenia, you're more at risk to actually break that bone when you fall. Because what osteoporosis is essentially a decreased density of our bones. As we grow, and everyone says when you're little you gotta drink milk and build strong bones. Your bones are literally becoming stronger and stronger and thicker. But then natural aging process for every single human on earth is our bones actually become less dense as we age. So kind of this continuum of, hey, you're getting stronger and you're building these strengths as you go from a baby to just growing to your like peak growth of, hey, bones are becoming stronger. But then it's kind of like a bell curve of, hey, as you age, they become less and less dense. However, I will say is, yeah, as we age, there's this natural, everyone's doing it, your bones are becoming less dense. However, with movement, with exercise, with physical therapy, we can actually reverse that process and make our bones become more and more dense. What goes into this and why is that the thing is essentially this idea of you use it or you lose it. Right? Okay, if we don't work out and we don't, I don't use my muscle all the time, it's going to become weaker, right? Because it's just not doing the thing. Same idea with bones. So our bones are actually, I was talking about this earlier, like really cool, because our bones have signals and receptors in them to respond to stress. So kind of a positive stress of, hey, right now I'm standing up here, so I'm constantly getting input into my bones, and especially if I'm stomping on the ground, I'm getting input into my bones to say, hey, something's happening. There's someone knocking at the door. That triggers a response within your bones to actually regenerate and grow bone. So becoming more dense and making those bones stronger and stronger as we do this. Okay, what is a DEXA scan itself if we haven't heard of it? So a DEXA scan is measuring exactly that, of the density of our bones. Specific areas that medical doctors look at when they're looking at a DEXA scan to say, okay, where am I going here? What's the density I'm looking at? They look at your lumbar spine, so your low back, right in this kind of area, as well as like the top part of your femur, so a big strong muscular bone in your leg. Looking at those two areas, those are the two strongest historically areas of the human body. And the lumbar spine, kind of right in here. Yeah. So the femur catches like your hip and stuff, everything there too. But looking at these two areas to say, hey, are we losing some density here? Because if we are, all right, we gotta do some work here, because these are usually the most dense areas. That's where they can look too, specifically at the person too, of like, okay, hey, we know we got stuff working, we got less dense happening here and here. Okay, that means it's happening elsewhere too. That's where your provider can make the decision to be like, okay, do we need to look at your ankles? Do we need to look at your cervical spine or your neck spine and stuff area to get a little bit of a better picture there, and really expand out versus just scanning your entire body right away. And that would be definitely something you're talking about through with like whoever's ordering your DEXA scan, of like the primary care provider, like your MD referral and stuff there too, to say, hey, yes, I'm going for a DEXA scan, great. Oh yeah, they might already know, and if they don't know for whatever reason, you can say, hey, yeah, I've had a lot of stuff happen at my wrist before. Can we add that essentially to the menu too? Just to know and look at what's happening there as well, for sure. So that goes into kind of talking about, hey, okay, I have osteoporosis, what do I do about it, essentially? And what's really exciting within that realm of wherever it is in the body too, and really whatever this T-score is, of hey, how bad off am I, essentially? What can I do about it? Is there a point of no return? The answer is no. And what's really exciting within that is there was a study done in 2017 looking at 107 postmenopausal women, so a group from 65 and older, who had a known diagnosis of osteoporosis at a bunch of different T-scores. So there are people that had, a -1, there are people that had -4, -5, and even a little, I think there was one that had like a -8 something. Yeah. So there was 107 of these women that through an 8-month study were put through a steady group of resistance training. So just like you talked about with Byron and Bailey, of different squats, different movements, different everything, of putting these positive stresses through our bones. And what actually happened, the results from the study is every single one of these participants had improvements in their T-score, which is crazy. Like that never happens in scientific studies to say every single something was a positive outlook. Every single one of them was. All different rangings of, hey, how much did they improve, because that depends on the person, depends on the score and everything there. But every single one of them had improved T-scores, so their bones became more dense through this process, as well as there were no negative results. If no one got hurt, no one had a fracture, nothing happened throughout it, which is very exciting to be able to have that huge group of people to say, hey, there isn't a point of no return. There are some people that were on medication starting the study, but what they did with the study is they took everyone off the medication just to control for that. Because, I'm really glad you brought medication up actually, because there are medications that can help with the management of osteoporosis, especially early on, is there's 2 big classes of medication, basically medications that help build up bone, so they're like essentially trying to make that bone a little bit more dense. Yeah, as well as a medication that tries to stop the bones from becoming more dense. So there's one that can help basically grow bone, for lack of a better term, as one is just helps to try to stop the process. But being able to have those and pair them with some level of resistance training and impact training and exercise with it as well can really only help with it too. And what I've seen just with people I've worked with too is they'll come to me and say, hey, I've got osteoporosis, my doctor just put me on this medication, but they also told me to come to PT, XYZ. I'm working with them and we get to the point that their doctor's like, all right, hey, your scores are good and improving enough that let's take you off this medication. This is great, you don't really need it anymore because you're improving so much in that realm. So especially just in people that I've worked with, as well as just studies and research studies and stuff I've read, there's definitely a time and a place for the medication, especially early on of, hey, we're figuring this out, and especially if those T-scores are lower, because it's like, all right, we gotta do something about this, and try to throw as many things as we can at it to start, but then as those T-scores improve, to be like, all right, yeah, we don't need this medication anymore. So thinking with that, similar ideas to the medication. People I've seen, I can honestly speak to, or I've seen a lot more people just with different levels of medication. I've only seen a couple people who've gotten actually the injections, still had positive impact of it, of hey, it's helpful, especially in the interim and the short-term aspect of it. But then pairing that with resistance training and exercise to be able to have those really long-term effects of, hey, your bones are staying stronger and more dense for longer because you're just able to move your body longer versus getting injections over and over and over again.